So welcome to Love Heals Cancer and Zenonco.io. I'm Astha from Zenonco.io. This is our cancer healing journey talks where we invite speakers who have gone through cancer, maybe as a patient, caregiver, or survivor. These CHJs are very close to our hearts because many patients tell us that when we listen to other people's journeys, it inspires them, it helps them boost their confidence, and it gives them hope that if others have been able to successfully beat the disease, then why can't they? So, thank you so much once again for joining us today for our cancer healing journey talks. And could you just introduce yourself and tell us how did your journey start?
Thank you, Ashta, for having me. I appreciate being here and sharing my story. Um, my name is Juanita Prada, and I had acute lymphoblastic leukemia when I was 10 years old and when I was 14 years old. And that's how I am here, and I'm going to be sharing my story with you today.
Okay, so how did your diagnosis happen?
My diagnosis happened, the symptoms started happening with, I had some fatigue, feeling very tired. I had some leg pain. I had a high fever, really high fever. I had some anemia and some bruises just out of the nowhere. And I had joint pain, and I remember just having really bad leg pain. And that's kind of everything started to evolved. I also had I would bleed a little bit easy. And that's how it started to evolve everything.
Okay. So did you have like any pre-existing disease or did you have any family history in cancer?
No, I did not. This was a total shocker for many. No pre-existing conditions or no family members.
Okay. So like when like what was your reaction and what was your family's reaction when you were first diagnosed with cancer?
Sure, yes, it was something that was very shocking. It came out of the nowhere. I was a child. I was 10 years old. So I did have a concept of that my hair would be falling out. And as a young child, female, I really was scared of that. And I was scared of of dying. I understood that I understood the concept of death at that age. So I was really scared of dying. I was scared of my hair falling out. And I was scared also of having to be separated from my friends. So I was very worried about all those things. My family, they were very in shock as well. They were very like, how did somebody so healthy, a child so healthy out of the many people, many children in the world, why my daughter, why her, why me? So they were very upset, and yeah, everybody was just in shock.
Yeah, it just comes as a shock, right? So
Yes,
like what treatments did you undergo?
I underwent chemotherapy. I underwent so I had cancer twice. So the first time I had in 2003, I had chemotherapy and a lot of blood transfusions. And then the second time I had chemotherapy and radiation and blood transfusions. So those were the treatments that I underwent.
Okay. So like did you face any side effects during these treatments?
So during this treatment, I faced side effects. So from the treatment, of course, the hair fell out. I had to take a lot of medication that gave me, there were steroids. So some of the side effects were me just getting bigger and a little bit chubbier. Other side effects I had a stroke when I had at the beginning of my treatment the first time, and this stroke caused me to later on in life, which I still face now, cause brain damage, permanent brain damage in an area where it helps with my memory and my learning. So I do face learning disabilities. And those are, I would say I would call them in two categories: the side effects that I had during the cancer treatment, and then later on in life, what I deal with now.
Okay.
Yes.
So, did you take any alternative treatment or any complementary treatment?
So alternative treatments, no. I took just what kind of what the doctors just what they just recommended. We didn't try any holistic stuff back then. Just really just the chemo and the radiation and the medical treatment, but no other. We didn't explore anything else.
Okay. So, like, how did you manage your, studies and, social life back then?
So I did not go to school. Since I had the stroke, that stopped me from going to school for a long period of time because I couldn't walk, I couldn't talk, I couldn't do many things on my own. My memory was really bad, so I didn't go to school for a while, and I would say for about a year. Later on, when I got back into school, I started just, trying to go to my normal self again and start kind of socializing with peers. Obviously, I felt like I was very, very different because I had no hair. I went through something so traumatic that nobody else in my classroom could understand. I told you that I went through this 2 times. So I was a young child, and then I was an adolescent, a teenager. And so it was very hard. It was very hard transition from both of them, just because I was in different ages, and kids are mean sometimes. So I did get bullied, make fun of, but then I also had friends who would really be nice and help come join me, come eat with me at the lunch table. They would come visit me at my house when I couldn't go to school. I couldn't do many sports or extra activities after school because of my immune system. But I was very involved in just helping out with, if it's like a team, if I'm going to a soccer game, they would ask me to, hey, can you help with the water? Can you help? Just very light stuff, just so I feel included. So that was very nice. So I had many, many, many positive experiences. And then I also had some experiences that, like I said, they didn't understand, and were a little mean, but yes, so it was kind of both, but I would say I did have, in my case, thankfully, I did have a lot of positive experiences and inclusion.
Yeah, that's nice.
Yes.
Like, did you try any recreational activities and all at that time, to manage your emotional well-being and all?
So during the hospital, I'm going to talk a little bit about the hospital. I had some what is called a child life specialist, and a child life specialist focus on helping children in the hospital understand what is going to be happening in child language, and they help to educate, and they're advocates, and they help to reduce the stressors and anxieties that a child or an adolescent may be facing. So a lot of play is involved. So a lot of activities that they would provide me with in the hospital would help me keep my mind off everything. And that helped me kind of relax and cope and distract. A lot of distraction helped me distract to not think about what was happening in the moment. If I was feeling very down, that would help to distract me. And that individual helped me to just talk to me and kind of just hear me out, somebody to listen. Also, my family, the whole time in the hospital, out of the hospital, they help also to just help me to hear me out and help me with whatever emotions I might have been facing. I would also sometimes go see a person, a psychologist or somebody who would also listen to me, because there's many traumatic things that would be happening. And I was able to just go and tell that person, how I was feeling. Anytime that I got visitors, that would be nice because I would be able to talk to them. That made me feel better. So there were many, I would say, circumstances which I had individuals come into my life that would help me to just have that positive energy within me and help me to just get out of that state of mind.
Okay. Yeah, that was really helpful, I believe. Yeah.
Yes.
So, did you remember going through any, major lifestyle changes like in your diet or exercising and all after your treatment?
So after my treatment, really I started taking it easy, just because of everything that had happened. But I do remember, like, as I got older, I started really enjoying to run. And when I had my portacath taken out, I was able to do more exercise, and I was able to just really think and think about, like, wow, I just had this big thing happen to me twice. How can I was more mature, and I kind of had an understanding of how can I help myself just keep going with a healthy life. So I did start just doing more exercise, going out and going running. Yes, I ate healthy just ever since I've ate healthy. And really just as far as a change of lifestyle, before cancer, I was feeling like I needed, I was a kid, but I always got things done quickly. After the cancer, since so much damage was done to my brain, I had to realize that I couldn't go quickly anymore as far as education. So I really had to, how do I say this? I really had to understand and listen to my body and say, Juanita, you need to take things slower. It doesn't matter if your friends are going faster, like in education. You do you, and you take your time, and that would help me really. It would help me get better grades in school because I would take my time. So it didn't matter if my friends were, I was in a special education class. So for me, that was a little upsetting because I was put separately from my other friends, but I, in my mind, knew that I would get extra help. So again, it didn't matter how long I took. That was a lifestyle change of just understanding my mental health and just understanding me as what I can do and focus on me. Yes.
That's nice. So, I have one more question. What were your top three learnings from your journey?
My learnings from my journey. Well, my learnings from my journey, I would say that um, uh, forgive me, I wrote something good down, and I
No
think
worries, no worries.
my learnings, no matter how challenging something is, I will get through it. So no matter what obstacle comes my way, I know that after beating childhood cancer twice, whatever challenge comes my way, I know I would get through it because I got through something so big as a child that you can throw anything at me, and with a positive attitude and mentality, I feel that anything could get done. I say live in the moment, living the moment, my life consciously aware that each moment I breathe is a gift, right? I think that's something that I wake up every day and I say, wow, God, thank you for another day. No matter if it's a dark day, no matter if it's a bright day, I'm just so happy to be breathing and alive, because I got that opportunity to be here. And just gratitude, feeling happy and feeling fulfilled no matter what is happening in my life. I'm just grateful for life. I'm grateful for being present here, talking to you, to many others on social media. I am grateful that with this survivorship journey, I'm able now to share my story with many, many other people through my advocacy movement, Be Whole, Be Gold. It is something that I think it's important for others to understand and learn about, since we're talking about learning, that just because a child survives cancer, it doesn't necessarily mean that the challenges are over, right? And that's what Be Whole, Be Gold, my movement, is about. Really taking this into consideration for others to know that children survive, but we still struggle later on life. So I'm just grateful that I am here, and I'm grateful that I'm able to speak about this. So those are just lessons that I've learned through life that, if you have something, speak about it. And yeah, it's something about it.
Yeah, it was just, full of positivity, like the way you
Exactly.
told everything. Yeah. So, like, what message would you like to give to, cancer patients and cancer caregivers?
Yes, I would say surround yourself with positive individuals who will energize you, and a good support network that will be there for you on those days that you just want to give up or feel helpless. So I know that this could happen to me even today. I'm a very optimistic, positive person, but whenever, I am a person and I do get down. So even if you're going through treatment, I think it is something that is very important. You're going through so much anxiety, depression, loneliness, right? I think it's very important to surround yourself with people who are going to kind of lift you up. When you're feeling just done and you just want to say, there were many times that I said as a child, I just want to die. I just want to die. I just want to die, because there's so much. It's just the treatment, the procedures, the pain, the uncertainty is something that gets you, and the medication as well. So it's something that you need to have that support system. And I think that's just very crucial. And those people are going to be there. You want all the people who are going to, again, lift you up and help you regain that energy that you are missing.
Yeah, that's really nice. The message that you gave. So I have just one last question from you. Like, if you have to sum up your entire journey in a single sentence, then what would it be?
Yes, I would say resiliency in the face of adversity. So just really, it's something that you're going through the hardest thing in your life, and especially being a child, and or an adult, and you're gone through adversities, right? Cancer is an adversity. And just having that resiliency later on in life is what makes you the person who you are today. That's what made me, just having that resiliency. So resiliency in the face of adversity.
That was really nice. So, thank you so much for sharing your journey with us. And I'm sure that it will help so many cancer patients and caregivers in the world. And it was really very inspirational the way you explained everything. It was really very nice. So, thank you so much once again for being a part of our cancer healing journey. Thank you
Thank you
so
so
much.
much. Thank you for having me. I appreciate it.
Yeah.